to extended roles, operational and legislative clarity, wellness and mental health, gender-based violence, and also human rights measures, and present what have been the emerging good practices and lesson learned during COVID preparedness and recovery by the law enforcement agencies in different country contexts. We'll try to reflect on if certain states within different federalistic structure in South Asia has responded or were prepared differently than the others, and also to see if the response was different in urban or rural settings, and also to examine the reason why. The second session, the final session of the workshop, will look into the way forward and an outline of security sector governance towards improving professionalism, efficiency, and accountability for future health crises. With that, we'll start the presentations for today, and I invite DIG Sharjil Kharal from Police Service of Pakistan to give his presentation. Mr. Kharal.
Yes, good morning all. And I must compliment DCAF for what has been a very useful, very useful sessions over the last 2 days. And we are nevertheless into our final day, but very important sessions to look forward to, the current one and the one towards the end of the day. Much has been discussed over the last 2 days, and I shouldn't be saying this, but what have been discussed over the last 2 days were basically challenges, gaps, and deficiencies in the overall rollout of police responses across different jurisdictions of South Asia during this current pandemic crisis. But today, we would hopefully be discussing about some flashes of brilliance in the process, and also we'll be looking up to some rays of hopes as to how our response can improve, and then of course what good practices emerged out of our response over the last year and a half, so to say. And as I said, and as I've been saying over the last 2 days, that our responses have pretty much, reflected the working culture of our respective jurisdictions. So when we are putting down our responses or our, in this case, our good practices, please bear in mind that these are quite tailored, and these are reflections of our working culture and environment in our country. So naturally, different jurisdictions of South Asia have experienced differently, and their police have responded differently. So for Pakistan, and at least the 2 regions that I've been part of over the last year and a half, we have certain, ideas, positive ideas to draw home upon, to fall back upon, and to then carry them forward for the rest of the pandemic crisis. And I hope it doesn't last very long. For us here, we realized and we actually felt that our middle tier of police officers proved to be an asset when we were implementing different provisions of lockdown or implementing different directives by the government. Here in our jurisdiction, normally it's felt that the senior most command and the lower constabulary are the ones who bear the brunt mostly of all such provisions and all such directives. But for the first time, at least in my career span, I felt as a police commander that our tiers of ASIs, assistant sub-inspectors, and inspectors proved to be an asset, and they actually were the bulk of the manpower and the force which helped us implement the government directives. And of course, we must say that they're the ones who proved to be the cutting face or the actual, manpower to be reckoned with when it came to coordinating with the community, coordinating with the hospitals, the health authorities, and also with other paramilitary agencies. Secondly, we feel here in Pakistan that police role was highlighted and appreciated as frontline workers, along with health personnel. They were doing their particular job by making sure that the quarantining, initially when we started out, the health authorities were focusing on creating isolation spaces and quarantine facilities, converting their hospitals into such facilities to respond to this crisis, while we were out on the roads, sensitizing community about do's and don'ts during the COVID situation. So our role was highlighted and appreciated along the lines with the frontline health workers. We feel that we had improved police-community relations. Yes, there were tense when we were trying to keep people off the roads and trying to keep them indoors and actually forcing them to deviate their routes while traveling to work, or forcing them to close down their business. But at the same time, through better conduct, through better liaison, and through a strict implementation, we were able to make some progress in this particular area, and much depended upon our conduct, our behavior, and the way we were carrying out our business or our directives that we were implementing in a fair way. So that's one positive, which I felt that was a good practice, and we need to further strengthen this and further improve this. Fourthly, the standing operating procedures and notifications have been there for a long time. But this time around, since this was a special occasion, a special crisis, special phase, our officers were exposed to these directives, notifications, and standing operating procedures for the first time in such a massive way, where they actually were made to read these, made to understand these, and they were asked to implement those after getting clarities from senior commanders like myself. So this was a new exposure to them, even though these papers and these documents have always been there for certain other factors, in certain other phases, and in different times. For us, personal health care became priority. We felt that ourselves and as a workforce and our families were important to us during such crises. Though it's unfortunate to be part of this, but at the same time, these unfortunate opportunities also give us a positive opportunity to take care of ourselves much better than ever before. We were help and an asset to the federal government authorities and the provincial civil administration and health authorities when it came to contact tracing. Because we are a police force of over 150,000 rank and file in this province of Sindh. So it is one of, and arguably the largest government department working in this province. So through us, we could reach far and wide in every nook and corner of our cities, our towns, and our villages in order to trace positive cases, or to help the federal authorities and the provincial health authorities to reach out to potential victims, potential patients, and at the same time roll out our preventive care mechanism. Our capacity building schemes were designed for us to play the new roles, was successful. We, along the lines, as I said earlier, yesterday and the day before, that we had held briefings, workshops, had doctors come over and train us, had doctors come over and teach us, sensitize us to the do's and don'ts during this crisis. So in the meanwhile, having said that, I'd say that our single constable or a simple constable in my force presently is much more well aware, much more sensitized than February of 2020, so to say. We played a part in the interagency coordination to control riot situations. When food distribution was an issue, when closing down businesses in a city like Karachi was an issue. So we, along with the Rangers, Army was hardly called here, but we, along with the paramilitary force, which is Rangers, and a lot of other jurisdictions on the screen here would have their counterparts of Rangers in their countries. Our coordination was, I feel, top of the line in order to control riot situations in mega cities like Karachi, and of course we've got Dhaka, Delhi, and Mumbai, and Colombo there as well. Our coordination with health authorities was remarkable because they were heavily reliant on us, heavily dependent on us, and we helped them secure the quarantine facilities. We helped them secure hospitals. We helped them actually, queuing up people when they were going for their COVID testing. We helped them keeping people indoors in certain occasions where certain patients required certain special health care. We actually reached out to people on their behalf, to their homes, to their businesses, and so on and so forth. And in this world and these times of media explosions, social media, and through Instagram, WhatsApp, Twitter, and tweeting, our coordination with media was remarkable. And through this coordination, we were effectively able to reach out to different people and to the public en masse to sensitize them regarding the rigors of the pandemic and the important issues that were to be highlighted with regards to enforcing lockdowns or carrying out government directives. So these are some of the best practices we felt that were important to be highlighted here. And I think I've covered a few aspects here, and of course I'm eager to listen to the rest of the esteemed speakers. They may have their own experiences as to what emerged, what practices emerged as good practices, and what could be lessons learned for us to carry those forward and build upon them and further strengthen our role in this pandemic. Thank you.
Thank you, DIG Kharal. That was very good to hear that there were also good lessons to be learned during this pandemic. And as you said, that hopefully we will build upon these, and then we'll make sure that our capacities and our professionalism is better to react to the future health crisis. With that, I will request Dr. Sarangi, Senior Police Officer from Indian Police Services. I think you're doing the presentation in collaboration with Mr. Jayanto.
Mr. Chaudhary will be speaking first.
Mr. Chaudhary.
Thank you, Ms. Garoo. And it was interesting hearing the DIGP from Pakistan speaking, because as he himself has mentioned before, there is actually so much in common, and not just with Pakistan, with all the other countries. So here are some of the key takeaways of the experience from India. The first is COVID policing in India, especially at the initial stages, was primarily local. Now, the lesson learned is that a systematic approach to evolving national guidelines would help avoiding reinventing the wheel in future contingencies. Though when you have that kind of a framework, there's always a danger of fighting the last war. We have an available template in India. It's called the Crisis Management Plan for Biological Disasters that was recently issued by India's Central Ministry of Health. Now, this acknowledges that health is a constitutional responsibility of the states, just as policing is. In India, we have certain subjects that are responsibility of the union government, some for the state and some are concurrent. Health and policing are both on the state's list. Now, yet this defines a response at different levels, from the national and state down to what we call Panchayati Raj, that is at the village level, and urban local bodies, that is in the cities, the municipalities and so on. The second takeaway is now, government budgets are likely to shrink because of the unprecedented negative impact on the economy. And there will be, and there has to be an increase in expenditure on social services like health. Yet, if we want the positive experience of policing during the lockdown to be sustained, then we need to figure out ways on how to project the need to increase expenditure on the civil police. Today in India, expenditure on civil police is less than $1 per capita per year, compared to $350 in the US. We don't need to reach US levels, but there has to be a little more investment in policing. Now, it is interesting hearing from different countries what laws and regulations, and we, of course, we have our own. Now, laws and regulations are enabling, but enforcing restrictions that have such a great impact on society is easier with greater engagement with local communities. Outreach efforts showed that such a changed relationship is welcomed, and soft skills are effective in persuading a majority of the public. There'll always be 10% who will not be persuaded, but at least 80 to 90% will go along with effective persuasion. Also, as was stated by our colleague from Pakistan, the police were on the front lines of enforcing restrictions, but a coordinated effort with other government departments is critical. Not just health, municipal authorities, public communications, and even the military, the army, and they have their own, each has its own resources that can be leveraged. I mentioned before, only a whole of government and a whole of society effort can be effective. Now, digitized policing services were expanded during the past year to avoid personal visits by the public to police stations. Developing platforms for online delivery of policing services now needs to be systematically pursued, as also digital avenues for addressing public grievances. Even our courts function minimally, but even they functioned online. Video conferencing from prisons in many states were used for court hearings, and this helped avoid prisoner escorts that are a drain on limited police manpower. The experience has validated potential synergy of ICT connectivity between different components of the criminal justice system. Now, good leadership paid off at field levels. Practical planning at the granular level, effective interdepartment liaison and rapport, and close interface with neighboring jurisdictions. Repeated briefing of field personnel and addressing their welfare concerns, and proactive community outreach. Also, holding credible media briefings to combat fake news. At times, this seemed to be a parallel epidemic. Pandemic policing has shown that meaningful changes in police practice and culture can be made by practical innovations at ground level and by the conduct of police leaders themselves. Now, we saw that frequently the lowest ranks, the constable, decided action on the spot against individual violators. This has emphasized the urgent need for capacity building at the base, the constabulary. And as we mentioned yesterday, you might need different andragogical methods to achieve this. Training, at least in India, needs to be less militarized and develop skills such as the ability to bridge the police-public gap. An important training outcome is for every policeman or woman to see their role as a protector or a guardian, to understand that Only a minority of people are lawbreakers, and therefore to conduct themselves accordingly, even when enforcing laws such as they had to do in the past year on the wider public. 1,200 police personnel in India have so far made this supreme sacrifice and are our COVID heroes. These brave hearts will be added to the roll of honor of 35,000 police personnel killed in the line of duty in India in the past 60 years, and whose names are embedded in our National Police Memorial. Yet, the public image of the police is that of a ruthless, corrupt instrument in the hands of power centers, rather than as an impartial servant of law. It was seen in the past year that a positive image can enlist proactive public support. That's essential in contingencies like the pandemic. Moreover, an improved self-image also helps lessen stress factors for the police personnel themselves, as we had discussed yesterday on the session on mental health. Now, pre-pandemic, policing challenges in India had to factor in trends like a demographic youth bulge, increased rural to urban migration, and widening economic inequality. These have all contributed to increased social tensions. The economic impact of COVID on public order and crime is still an unknown. India's GDP is estimated to have fallen by over 5%. And the middle class, that was the engine for India's economic transformation in the past 30 years, has shrunk 30% in the past year. We still don't know how this will affect our policing challenges, which is why the experience of pandemic policing is an opportunity to review conventional practices and relook at what were traditionally our focus areas. As an example, India has one of the highest proportion of under trial prisoners in the world. During the lockdown, the Supreme Court had issued directions for the release of under trial prisoners to reduce overcrowding and hence the spread of infection in prisons. Now we can actually, we should sincerely and systematically go in for a review of arrest as a routine standard procedure during investigation. Emerging new age threats like cybercrime and white-collar global crime syndicates increasingly impact on the ordinary citizen. And like pandemics, they don't recognize national borders. This has taken on a new dimension with an upsurge in digital crime during the pandemic. Also, Interpol has warned of a dark market in COVID vaccines because of the huge demand worldwide and potential for counterfeit vaccines. Now, you may recall that the Pelian model of policing emerged as a response to requirements in London post the Industrial Revolution. Interpol came about as a response to the globalization of crime after World War I. This pandemic is a wake-up call to relook at policing doctrines and take account of anticipated challenges, as also the need for scientific research to change older attitudes and methods so as to be more in tune with contemporary society. Now, who can declare with confidence when the COVID pandemic will end? This is a challenging time, but it's also an opportunity, at least for us in India, to move towards a policing system that is more professional and with a culture of public service. In years to come, our COVID warriors will remember their role and hopefully be remembered as a generation of police officers who, by their committed and innovative handling of an extraordinary contingency, heralded a new chapter in Indian policing. Thank you very much. Over to Dr. Sarangi.
Thank you, sir. I thank Mr. Chaudhary for recommending my inclusion as a panelist in this forum. I've learned a lot. In the past, we have dealt with epidemic. This turned out to be the first global pandemic. So our laws are related to epidemic and we are dealing with the pandemic. We require a pandemic playbook, which has to be comprehensive. For once, the government, in case of a global pandemic, becomes one large health ministry. And every agency then becomes part of the health ministry. All that you are attending to is work relating to public health. As our friend from Pakistan has said, the frontline workers were indeed applauded, policemen were applauded all over. We have earned a lot of goodwill and trust, but I'm not very sure that they will last because of the baseline effect, which is to say that even if you do 100 good works, one bad thing will spoil the remaining 99. And this is a predicament of the police globally. I entirely agree with Mr. Chaudhary. We have to empower the constabulary. They're a very large manpower. This is one problem in South Asia, which we have inherited from colonial times. Our police constables are, as it is said, spear carriers in the background of the police drama. We have to ensure that they become really decision makers. They have that initiative. They can take decisions. So you have to get rid of things like keeping them in barracks in large number. And barracks cannot be built in a single day. You need to provide single room accommodation for them. Get rid of your barracks. Provide them separate toilets. I'm talking about some very practical solutions. Get rid of your truck system of transporting people, your police personnel. Provide them with squad cars like in the US or UK. Basically, if you want police to be able to effectively support the public health measures, then police has to be provided with a lot more of resources. We clearly found there was a gap between expectations from the police and the resource available with the police. Statutory changes should be required in two respects. One is our operational doctrine relating to use of force has to be revised. You cannot use force in case of a pandemic. Then how do you regulate? This was the biggest challenge. Second is you have to decriminalize enforcement in case of a pandemic. You cannot use your coercive powers of search, seizure, and arrest in case of somebody violating social distancing or COVID norms. I think we need a lot of improvement to our command and control system, better communication, onboard computers, better radio facility, digitized ways of handling to public requests, many of them GPS based, GIS based, so that you can localize, you can know who has been permitted to go where. So you have to depend on technology as a force multiplier. I don't think this is the last time that we are facing this kind of a situation. We will have many more emergencies. Unfortunately, in these countries, we have continued to invest more in the army than in the police. So resources have to now move from the army to the police in terms of strengthening your rule of law mandate. Development requires two prerequisites, and I am following here the Asimaglo-Robinson model, that these two are prerequisites of economic development: democracy and rule of law. So a lot more of investment is required. In terms of training, besides the pandemic playbook, we need some improvement, some understanding of infection in the public health and health issues in our training system. So largely, I agree with most of the points that Mr. Chaudhary has made. These are only supplementary points. I expect that the goodwill that has been earned would be converted into proper documentation. And this is the time for those groups involved in advocacy of police reform to put forth this as an additional point as to why these South Asian countries also require well-equipped, professional, well-resourced and trusted police force. So this is the direction in which we should go. There is a lot of good things that I've learned from different countries. In fact, I was very happy that all the presentations were remarkably good. So every police officer tried his or her best to protect community, and this has been phenomenal. I hope this can be continued, maintained, and in the future we have a better South Asia, more prosperous, more peaceful. Thank you.
Thank you, Mr. Chaudhary and Dr. Sarangi for your presentation from Indian Police Services. Now I will invite ASP Ismail Naveen, Maldives Police Service.
Shall I share the PowerPoint?
Yeah, sure.
Yes, Flores, yes.
Yeah, thank you very much once again. And last 2 days, we have been discussing on police in the pandemic. And actually, I gained a lot of knowledge from all the panelists and all the discussions. Today, what I'll be discussing is about the emerging good practices that we learned and still we are learning during this pandemic. What we have learned from the past year, I think we'll be talking about it a lot during our careers and also after we retire on how things were done in the future epidemics or any pandemic. The whole world was working on a single goal. Politicians, parliamentarians, health experts, doctors, police, army, economists, air traveling has changed, transportation, land, sea has also changed with it, and so many other things changed. And there will be changes in the way things have been done previously before the pandemic to prevent such a epidemic or a pandemic recurring in a near future. I think something that we learned is about food security, health security, and transportation security as a whole when we look at the whole system of things that we have done in the past year. And as police officers, we have to be reminded over and over again how the criminals and crime organizations try to use the opportunity during the pandemic in making counterfeit medical equipment, medicines, and their MO was changed to accommodate the pandemic. Cybercrime and internet crime, internet fraud increased so that because there was so many online shopping and online deliveries as well. Next slide, please. Some of the things that the good practices we saw was about the human behavior, how people behave during the pandemic by maintaining physical distance in all modes of transportation and even walking on the streets. I think it's still with the curfew over in the Maldives, still we are finding people, emptying the streets by 9 o'clock or 10 o'clock. Most of them are at home, wearing masks and being very hygienic on use of public places and all. Frequent cleaning and disinfection of equipments of what they use. Even in transportation, they have been doing this over the past year. So it has become a norm for them to do this, even though the infection rate is going down. Seeking professional advice, medical advice when in doubt has increased, and even wearing masks and being cautious has brought down the normal flu in places. When we see monsoon rains, it has gone down. And using police expertise in the health sector has increased in the last year in contact tracing and transportation and enforcing public health emergencies in all the islands in the Maldives as well. The use of police applications online and using police officers' smartphones to enforce law and even criminal backgrounds could be checked right now. Next slide. I'll just go through some of the pictures that just to give a sense of how things happened here in the Maldives. When you see on the picture that you see on the left hand up is during an exercise just to prepare for the worst come to worst, and it was done by the public health officials. The army and the police were part of it just to get a sense of how things will be going around. And on the bottom corner is team from rapid response of the health emergency. They have taken random sampling from a few houses and carrying the samples to the ambulance. The next one, please. The first picture on the right side is police checking permits, which has been issued to vehicles, individuals during the curfew. And on the up left is a picture of police overseeing containment sites where expat workers were there and who were infected in that sense. When I say expats, these expats were given medical care free of cost, and even sometimes had to be taken into hospitals to treat them if they were at risk. And down again, it's during the curfew timings and movement controls, police officer on the streets. Next slide, please. Again, the same going on, and when the inoculation started, police, just to increase public confidence, politicians, parliamentarians, police, army, and everyone were inoculated in public media, just to bring the sense to the public that it's safe. It's going to be used by everyone in the country. Next slide. This has been a very debatable issue of managing the dead here in the Maldives even, and we had assigned the health ministry and the Islamic ministry assigned one cemetery to be used in the greater capital area to be used for burials of COVID positive deaths. Next slide. Well, lessons learned is something that we all will be talking again. As I mentioned, laws and regulations will be enacted for future pandemic and crisis responses. Interagency operation SOPs will be redone, and more streamlining will be done in the very near future. The roles and responsibilities of private and public sector in responding to crisis situations is something that we learned a lot in terms of volunteers, their expertise, their knowledge, and things like that. Importance of developing and using artificial intelligence and technological advances in policing or managing such a pandemic. Use of criminal law in non-compliance and the unintended consequences to the police and the community relations, because it's not been decriminalized yet. The risk and security management and the expanded use of artificial intelligence technology throughout both sectors, health sector, the policing sector, even managing the whole pandemic was done on technology. The impact of the pandemic on the health and wellness and resilience of officers, the family system, and the police organization will have a really big mark that we need to change in the near future. for the next few years, which will be changing a lot. Just keeping in mind that the whole thing has such an impact on the policing and the way we look at things in the community itself. That's all in short. Thank you very much. I'll be taking any questions during the question and answer timing. Thank you.
Thank you so much, SP Ismail Naveen, for your presentation. Now I will give the floor to SP Sabin Pradhan from Nepal Police for his presentation.
Yes, good morning and good afternoon once again. I'm here in the fifth session with emerging good practices, lessons learned during health crisis preparedness and recovery in South Asia, with special reference to Nepal. In this one, as we had the instructions of covering at least 4 of these points, so I'll be focusing my presentation in these points that have been communicated by DCAF. So when we talk about good practices and lessons learned, there were many things we learned during the pandemic, and although yes, we had to suffer a lot, but in a way it has been a great experience for law enforcement officials, because in normal situations in a country like Nepal, where we don't have so much of conflict in terms of terrorism or internal armed conflict, it's basically a situation which is normal. So police act alone, and the paramilitary forces and the military forces are on their own in their own barracks, and we don't get the opportunity to interact as much as we would have wanted. But this gave us a lot of opportunity to actually plan and execute a coordinated action response to pandemic, because we were the ones who were out on the field. That was one advantage. Well, we will also talk about the other side of the same coin, because yesterday one of the speakers talked about militarization. So having a lot of armed personnel on the ground does not always do good. So it might be taken in a different perspective as well. But in my perspective, in my experience, what I realized was having all the security personnel together, performing the same role in a coordinated fashion, meant a lot of confidence to the people who were actually who did not know what is going to happen, or even if they knew, they did not know the magnitude of what was going to happen or what was about to happen. So just by looking at the actions taken by the security forces in a coordinated manner meant a lot. And we were not doing the works that we were traditionally entrusted to do. What we were doing is something that a public health worker is supposed to do, personnel is supposed to do. So at that moment in time, we were the public health responder. And I think that is good, because we are the ones who are able to respond as quickly as possible when certain situations arise. And promptness is one of the key ingredients in terms of building trust and confidence among the people, that there are somebody, if anything happens, then we will get the assistance of at least the security forces in time. And what is good about the security forces in Nepal is we don't just come with the law enforcement officials alone. What we have is we have doctors, we have nurses, and we have paramedics who are all working together. So when they see police officer, they also see in the back of their mind that there is a hospital, the whole system is there, the health system. So that was a very good practice that we were able to follow. But we always had this in mind, that health sector and medical personnel are at the heart of the whole response. And therefore, although we were doing a lot of work in terms of coordinating, in terms of managing logistics, in terms of managing food supplies, but when it came to medical treatment, when it came to medical counseling, psychosocial counseling, we always had to depend on the health sector and medical personnel. So we were always in loop, not only with the private health sector, but also with the government health sector. So all the health, system, there were, we did not have the same sort of coordination as we started having in the later part of the pandemic, but we were able to somehow organize a sort of coordination among the different health sector and medical personnel, no matter they were from the public sector or from the private sector. And the other area that I would like to highlight upon is, when we talk about our emergency plan, operation plan, we are mostly talking about natural calamities. We are mostly talking about disasters. But this time, with the kind of impact pandemic had in the normal life, now we are bound to feel that emergency operation plan should also encompass the law enforcement response during pandemic, because this is an essential part of the social norm now, although it is more environmental and natural in terms of how we see it, because it's a virus. But we did not have the same kind of perspective, or we were not able to see it from the same lens as we saw it before. We did hear some of the past histories as to what pandemic has done in the past. We heard about Ebola. We are known about HIV in our own generation, but still, having heard them, we were not prepared. So this gave us a lesson that we need to be prepared for pandemic, and at any point of time, we might have to suffer another huge pandemic, or it can even be endemic situations. And then public outreach, when you talk about that, because mobility was completely restricted for the general public. Mobility was only facilitated for the essential members who were helping to cope with the situation. So public outreach was one of the area where we had to, find some way how we could reach out to the public and care for them and provide them the services that they needed. And to do that, we have to thank technology. Because of the technology that was there, we had online system, we have mobile platforms by way of which we were able to reach out to the people who needed the services, and we were able to also send out information to the general public so that they know what was happening and what is happening. So in terms of public outreach, I would say online and mobile platforms were very helpful, as has been pointed out by other speakers who has spoken earlier. And then essential services as emergency services. What we mean here is that we have to, we should be able to look at the situation that we would be in a situation that we have witnessed recently or still witnessing. For all the essential services, they should not be obstructed in any point of time. So even at the situations of emergency, these essential services should be able to flow. So it involves the health services, it involves other services that that has a lot to do with law enforcement, such as providing services to the vulnerable communities who are not able to come to the police offices due to travel restrictions. So how are you going to address the situations that they are facing? How are you going to address, how are you going to open up the door for criminal justice system? So these essential services should never be stopped. And in order to do that, we still need to do a lot of work. We have been able to manage to a certain degree, but is it enough? I would say no. Enough. There is a lot more we need to do in terms of ensuring that essential services can run in any kind of adverse situation. And the other area is virtual training. So we needed to sensitize the people. We needed to sensitize our own human resources. So, but most of the activities, even if we talk about the training centers, the training facilities that we have, were all in a standstill. It wasn't functioning. The whole system was not functioning. So what we reckoned is, unless and until we devise a system which can work in the situation of pandemic, we won't be able to raise awareness among the frontliners or the law enforcement officers who are actually catering services during the pandemic to the general public. So what we did is we utilized virtual training, and not only in law enforcement, I've seen even in the education sector, the virtual training has become very ubiquitous. You know, everybody is using, and we have become so used to it. The dependability has become so high, the reliability has been so high that we are confident that even certain kind of skills can also be delivered through virtual training. So this is, if pandemic wasn't there, then we would have not relied on virtual training as much as we are relying on virtual training due to pandemic at this hour. And the other part is culture and people's sentiment should be given due consideration. What I mean to say is not only culture, also religious. You can tell them to, you know, not to come out of their houses, to stay in their houses, but there are certain occasions you cannot prevent them. So what we've done through our experience and through our, you know, work on the ground is that you cannot bar them for every single thing. Therefore, certain cultures are going to go on. They are going to observe certain religious ceremonies. But when they are doing it, we confine it to the minimum possible. That means minimum number of people will be attending. So there is a puja, there is a worship, then only 5 members of the family can worship. So you get only 5 members. In the previous instances, we would have hundreds and hundreds of people who would attend to the program, but we confined it to the limited number, not more than 5. So that was a big achievement and a good practice that we were able to practice. And during difficult and challenging times, gender issues should not be disregarded, because this gender issue has been suppressed for centuries. And even in the last few decades, if you go back, gender issues were suppressed. They were unreported most of the time. If you look at the data in Nepal, the data back a decade ago and right now, there's a huge difference, because now people are coming out and reporting the cases. So if you do not open doors to vent their issues out, then these gender issues will be suppressed. So in order to do that, we have to take every measure so that the vulnerable communities, especially women, children, and elderlies, are able to come out and have access to the criminal justice system. And then quarantine and isolation management, which was a very good practice, and we have talked about it in quite a length. So I'm not going to indulge in that for long. And then address wellness and mental health of frontline personnel. Initially, we did not care so much about it, but as we progressed into the full-blown pandemic in Nepal, a lot of people started caring for the police personnel who were out on the street managing the restriction of movement. So we had volunteers who would come with water. We had volunteers who would come to us with food supplies. So this was done by the community. But within the organization also, it was realized that we have to do something in order to motivate, in order to encourage the people who are out there on the front line, on the street, doing the duty over everything else. So the hospital personnel, staff members would come to us. We had stress classes, to de-stress our personnel who were on the ground. So in case of any contraction or infection of the virus, then we had a good, well-facilitated hospital where we could go and, treat ourselves. And not only treatment, the hospital also organized several different activities where we wouldn't stress ourselves away from the family. So that was, again, a very good practice. And there are so many lessons learned. We can do much better than what we have done. So in the coming days, whatever activities has been done, it can be, we can do it better. It can be improved. And we also talked about community-oriented policing during health crisis. I would say yes. Community-oriented policing can take a lot of different forms, but we have to utilize them according to the context. And interfacing with public to build trust, community policing is a vital tool. You cannot exclude community policing if you are doing a real policing, and especially in terms of pandemic. If you're talking about pandemics where there is a lot of fear among the community, there is a panic among the community, then this is the best way to go forward. Best way to keep people informed and keep them aware. Sometimes it might not have an immediate effect, but it always matters in the long run. Moreover, police job is people-centric, and therefore community policing remains at the core, particularly in addressing issues pertaining to vulnerable population. So by vulnerable population, I would like to again mention women, children, and the elderlies, and also the disabled communities. And then where others fear to trade, police are there. It gives them a lot of confidence. It encourages them to do their job because we are there. If nothing is going to happen to the police who are out on the street, moving from one community to another, moving from one house to another, then we also can do certain work. So essential personnel who wouldn't come out would also come out because of the confidence of the police. And in COVID-19, we had a lot of examples, like we erected hand wash stations, distributed masks to the needy communities, facilitated grocery purchase, the markets, tracking of new arrivals, encouraging the victims and victims' family, collaborations with health authorities to raise awareness, raising volunteers, capacity enhancement and confidence building, radio, television, social media, and posters, and many more. These were just few examples that I'm citing here. So now, especially in terms of Nepal, we are very nascent in terms of the federal structure, unlike Pakistan, unlike India, because they have a long history of federal governance. But in Nepal, we are still in a very early stage. And if we talk about police, we haven't been able to readjust our human resources according to the federal system. So we are still centralized. We haven't federalized our structure. So in this situation, I'm not talking about police structure alone, but in federal structure, functioning of the local government at the local level was seen to be very, very important and very, very beneficial to the community, because they were able to prove why we need local government actually. So in federal structure, we have 3 layers of government. So local government has been very active and has been very useful in serving the community. But when we talk about provincial government, are we able to say the same? Not at this moment. They could have done more, but provincial government, the presence of their engagement with the community was very less. However, the central government was very busy in devising different policy framework, guidelines, and directives, mostly good on paper, I would say, but lacked a little bit of practicality. But when you look at the papers and the guidelines that we received, that gave us a roadmap up as to how to go about during the pandemic. And then finally, sharing of the knowledge, every piece of hard work that we have toiled on the ground is worth sharing. We come from different backgrounds. Although we belong to South Asia, our experiences are different. So it is always good to share experiences, those that worked and those that didn't, okay? They possess value in terms of learning. And in the region, it is of even greater value because we share similar cultures. We share similar norms and values. So what is being practiced in India will be of worth to us in Nepal. And similarly, what we practice here in Nepal will be of worth to Maldives, to Bangladesh, to Sri Lanka, Pakistan, and India. So it's very good. And I really thank for the platform that you have created where we could share so much of information. And according to my experience being here in the different sessions during the last couple of days, what I've seen is we have gotten information from that very high level. When Dr. Sarangi is talking, he's talking at a very high level, okay? And when we are talking, we are trying to connect those dynamics, those conceptual ideas, those practical sense that he's trying to make with the ground reality that we were able to experience during pandemic. So what this shows is we are not only at one level of sharing knowledge, we are also sharing knowledge at different levels. So I really like to thank Upasana for coming up with such a brilliant idea of creating this platform to share the information that is based on our experience at this very difficult time. Thank you very much.
Thank you, Sri Pradhan, for your presentation. And I think more than, I think I understand there has been so much enriching experience that has been shared within different countries in South Asia region. And we have benefited a lot and learned a lot. As we speak, we will also have a speaker from my colleague from European and Central Asia division. He will be sharing some experiences from what has happened in Europe. So this crisis is a global crisis. So I think its learning has to be exchanged from South-South, from the whole of the world. We're still making sense of how to make our efforts more professional and have more impact for our communities, which we serve. And with that, I will also highlight that the next speaker, who's ACP Noor, who from Bangladesh Police, who was with us in the first day, was called on the emergency COVID emergency duties right now, so he won't be available. So I totally understand that we are living this ongoing crisis as we are discussing at this platform. So thank you for sharing all your really brilliant experiences in dealing with the crisis practically. So with that, we have Indika Perera. He is joining us for today, but he's been involved with the network for a long time. He's a lecturer in Bandaranaike Institute of International Studies, and also he is the attorney at law and has worked on a lot of conflict resolution and crisis prevention projects in Sri Lanka during in 80s and in 90s. So I will now give a floor to Indika to share the experience from Sri Lankan police. And Ajit, I understand, sorry to interrupt, DIG Ajit might join us. I'm not too sure, but I think we have requested him if he can.
Yes, he was planning to join, but he had some emergency situation which needed his assistance, so he may not join, but he might join depending on the situation. And good morning and good evening to you all. And considering the time and considering the options, I will not go into very detailed tactical level activities, but more into strategic level interventions, which Sri Lanka was involved in dealing with the COVID-19 pandemic. And with the first local patient found on the 11th of March 2020, Sri Lanka had a very strict way of dealing with this situation. And in some cases, in fact, we were sometimes criticized also that Sri Lanka was too strict in dealing with the people on COVID-19 and how we are dealing with these things. But anyway, it has comparatively served us. So far, we have had 93,993 cases and only 591 deaths. So government was very strict in their strategy in case detection, in identification of close contacts. Somebody gets sick and then immediately everyone around him or her, and they were identified and then quarantined, and more than 100 plus new quarantine centers were built up strictly for these purposes, and those places were kind of guarded and were strictly kept only for these people, and no one was left out or in. And travel restrictions locally as well as all the seaports and airports were closed, and isolation of certain areas depending on the number of patients found and positive cases found. And again, the lockdowns happened, and the whole country was on a island-wide curfew on 20th of March 2020. And with all these things, the main strategy of the government was to minimize the contacts by preventing people from traveling. So that was the main idea. And for all the purpose, other positive thing was that we created the National Operations Center for prevention of COVID-19, a central operations center led by Army Commander as the head, General Shavendra Silva, and all the media as well as all the other operations were done through this central body. So everything related to COVID-19 was done through this center. And the main areas the law enforcement was involved in, I would like to summarize, were on preparing the law enforcement authorities. How did we prepare ourselves? How was it done? Mainly it was done responding and managing incidents, the COVID-19 related responding. When someone is detected, how would you respond, and then you manage it and diffuse the situation. And again, emergency support functions. Emergency support, this was done through mainly assessment of public health, the existing situations, the medical needs, including the behavioral health related situations, and public health surveillance. A lot of surveillance was done because there were a lot of issues that some of the Sri Lankans who were living outside the country, who had contracted the COVID-19, had come through formal ways as well as informal ways to the country. It was comparatively easier for us to deal with that because Sri Lanka is an island nation, and we were monitoring the airports and the seaports all together. But sometimes there were people who were using informal ways and means to come in. So this related, a lot of clusters were later created. Because of that, surveillance was increased, and provision of medical care personnel, looking after the medical care personnel was also handled by and supported by the law enforcement authorities, mainly the police, and acquisition of supplies and medical equipment was again coordinated and supported by the law enforcement. And the other main area was, other than the preparing of law enforcement authorities, was the protection of the officers, the protection of the actual police men and women. So that was key because, as some of you very learned friends explained, the police officers were the main frontliners. They were dealing with the people. They were the main first people to get contacted. So assessing the risk of officers depending on their job and depending on their activities, and then dealing with them and what kind of resources they were needing, and then immunization and personal protection equipment, vaccines, how much needed. At present in Sri Lanka, almost all the 99.9% of frontliners, law enforcement authorities, military, as well as the healthcare workers are now being vaccinated. And the protective clothing they needed, those were coordinated, the sanitization and maintaining of social distancing within work. Because what happens is, although the rules and regulations are there, when you are meeting with your peers, after a while you forget and then you start the usual stuff. And treatment of the infected and protection of their families. Sometimes the frontliners were afraid that they cannot go home. Some of the people were working for weeks without going home because of to avoid the spread of COVID-19 into their families. And the other main area is the protecting the community. How did the law enforcement was instrumental in protecting the community? Mainly working with the public and private agencies and the media institutions. It was little different than the usual policing work as such, because this was totally new, and I would say we were not as a country prepared for this kind of huge magnitude of natural, in a way, pandemic. And then because of that, lot of interactions, the trainings and connections were needed. So those were done through mainly connecting with the public-private partnerships and connecting with media institutions, and large-scale vaccination and preventive measures taking campaigns are also going on. At the moment, people who are more than 60 years are being vaccinated. And these are coordinated by, again, law enforcement agencies, and managing restrictions. That is the other main thing the law enforcement is engaged in: social distancing, area isolations, quarantine centers, and lockdown areas. So these are fully managed. And other main thing is the mass care planning. In case the hospitals cannot manage the situations, what will the law enforcement do? What will be the next step if the situation overwhelms and goes beyond control? So those readiness is also there, and awareness campaigns in mass media and social media involving communities in because prevention and having rules and regulations on these issues is also essential. But on top of that, engaging people and getting them connected will prevent a lot of issues, because then the people will own the situation. If not, they would, especially the young, when they are being quarantined or they are being kept or asked to be locked down, they after a while tend to think that this is something you have to break. People tend to enjoy law breaking sometimes. So all these things are being dealt with, and other main probably thing the law enforcement agencies were involved is the 2020 general election campaign, the whole election, the conduct, the campaign, and the election, which happened on the August 5th of 2020. So this was a major election island-wide. So this election was done with strict COVID-19 prevention rules and regulations, and even counting of the polling and the campaigning. All these things were done in quite a restricted manner, and in all these activities, the National Operations Center for Prevention of COVID-19, with the assistance of law enforcement agencies, were conducted. And other than those things, those were the actual activities related to COVID-19. But the normal day-to-day other work of the police had to be done. And other than that, with the new normal, there were new situations coming up, like violence against women and children were increasing, and cyber crimes, identity theft was a lot of cases there, and privacy violations, especially on social media, and because in most of the places, for surveillance and for prevention matters, the people's phone numbers and addresses were collected, and those were misused by some people for different purposes. So those has to be managed, and a lot of sudden surge of petty crimes also got increased because of many people losing their jobs and daily activities. So all these things were also had to be dealt with other than the COVID-19 activities. So in managing the new normal, the roles of the police, there was a quick shift in the traditional roles of the police. There was a transformation, and that transformation was more positive because it involved a lot of dealing with other institutions and dealing with a lot of communities and making them involved in this process. So this transformation is a positive thing, and we sincerely hope that, as one of you academics mentioned, maybe we could make it part of the concepts, and maybe these new learnings could be conceptualized and then be made part of our policing strategies, so that in the future we could have them continuously throughout. Because although the pandemic is bad and we lost a lot of people and resources and opportunities, there are certain learning points also which can help us in the future and which would help us throughout. So I think I'm going to stop now, and thank you so much for the opportunity, DCAF. And if there are any issues or concerns, we can deal with that at the question and answering session. Thank you so much.
Thank you, Indika, for your presentation, and also for highlighting the efforts that were made to have the elections in Sri Lanka. I think that's another topic we could maybe in our discussions dwell a bit more upon, and thank you for your inputs. I also see that in the chat there's already